Hi everyone. In this video, we'll learn about different types of sources for your clinical question. We'll talk about background and foreground sources, different types of studies and other sources, and the AOA clinical practice guidelines, what types of studies are best suited for answering different types of clinical questions. And this part essentially adds TT to your PICOTT question for type of question and type of article. We sometimes need general information about a condition, disease, treatment to help answer our clinical questions. So this is background information that you would find in medical textbooks, point of care tools, or reviews. You'll find overviews of information that have been compiled from existing evidence at the time that they were written. However, they're not going to provide you with the latest research on the topic. An example of a question that you might answer by looking at a background source is, what causes digital eye strain? Foreground sources are the research studies that you'll use for evidence when answering your clinical questions, such as, is there evidence that applying the 2020 rule reduces digital eye strain? You would need to look at research studies and databases like PubMed to find the answer to this question. For our other clinical question, we might find common treatments for dry eye in a background source and then look at our foreground sources, our research studies, to find out the current evidence for how effective omega-3 fatty acids are for reducing dry eye. You can access the relevant background sources by going to the Optometry Resources Guide and clicking the Background Sources page. You can also click the Evidence-Based Optometry page and look under Find where to look for evidence. Make sure to use these links as opposed to Googling these databases on your own. These are what provide you access as a Pacific student. Will's Eye Manual is an example of a background source. Here we're looking for information about digital eye strain and found a section on ocular pain. Up to Date is a point of care source and is used by medical professionals to quickly access information about a specific condition and see recommended treatments. Clinical Key is another excellent source. It provides research studies, but it has a lot of background sources. In this example, I searched for asthenopia and then limited my search results to books, since books would probably provide general overviews. I found this chapter excerpt about asthenopia. I clicked Control F on a Mac, click Command F, and searched for the word digital. I found where it mentions digital eye strain in this chapter. Last of all is Access Medicine, which has many medical textbooks, among other useful resources. I searched for dry eye and found this section on ocular pharmacology in the book Goodman and Gilman's The Pharmacological Basis of Therapeutics. It discusses treatments for dry eye and corneal edema. During this course, you'll also become familiar with the AOA clinical practice guidelines and the evidence they're based upon. However, we'll look at foreground resources and how to look at the latest evidence yourself. The AOA's clinical practice guidelines offer a grading system for evidence. Generally, studies with strong designs are grade A. However, remember the quality of the study is only as good as its design. So while a meta-analysis is generally a grade A, since it's doing a statistical analysis of the results of many other studies, if it's designed poorly, or if the studies it analyzes were designed poorly, the quality of the meta-analysis will be very low. So while it's important to understand these grades of evidence, remember to always think critically about the study designs themselves. Here are simple definitions of different types of studies that you can find on the evidence-based optometry page. So how do you know you're looking at a study? It will have certain sections such as an abstract or summary of the study and its results, an introduction which includes a review of the existing literature and how the current study adds to the existing literature, a methods section explaining how the study was designed, the study's results, a discussion of the study's results and their implication, and a list of references. If you see these sections, you can expect that it's a study. If you don't see these sections, you can expect that it's a review or another type of article. There are different types of clinical questions. For example, a therapy question asks about the effects of an intervention on certain patient outcomes. This type of question is best answered by a randomized controlled trial. This is because it's a trial in which participants are randomly assigned into two or more groups, at least one, the experimental group, receiving an intervention that is being tested, and another, the comparison or control group, receiving an alternative treatment or placebo. However, if there is a systematic review or meta-analysis available that combines the results of many randomized controlled trials, that would be even stronger evidence. However, other clinical questions cannot be answered by randomized controlled trials because it would be impossible or unethical. And so other study designs are preferred. So, for example, to find out whether a potentially harmful exposure may cause a certain disease, we would prefer a case control study or a cohort study because it would be unethical to expose patients to potentially harmful agents. So a case control study examines a group of people who have experienced an event, usually an adverse event, and a group of people who have not experienced the same event. It looks at how exposure to suspect, usually noxious agents, differed between the two groups. So for our first question, it is a therapy question, and we're ideally looking for a meta-analysis, a systematic review, or a randomized controlled trial. Our second question is also a therapy question, and we're looking for the same study types. For these study types, we can think of them as either primary or original research, meaning single research studies, or as secondary studies that review or combine existing research. Among primary study designs, these are experimental studies and observational studies. Experimental studies are those that use an intervention, and observational studies are those where no intervention is made. Secondary studies or reviews of research are studies such as meta-analyses or systematic reviews that gather existing research in a systematic way, and in the case of meta-analysis, perform a statistical analysis on the pooled results. Practice guidelines, such as the AOA's clinical practice guidelines, now review existing evidence and make guidelines for patient care. Here we can see that the synthesized evidence is the highest level of evidence, whereas experimental studies are lower and then observational studies are at the bottom. Animal studies are below that and are not listed in the evidence grades in the AOA clinical practice guidelines. So a meta-analysis is a statistical technique that summarizes the results of several studies in a single weighted estimate, in which more weight is given to results of studies with more events and sometimes to studies of higher quality. A systematic review specifies methods to identify, appraise, and summarize studies as addressing a defined question. It can, but need not, involve meta-analysis. So while these are synthesized evidence, they're also studies in themselves because they have a particular design and are laid out like a research study with methods, results, and discussion sections. These two study types, meta-analyses and systematic reviews, are of very high quality and are at the top of the evidence pyramid because the authors have designed a methodology for reviewing the literature on a topic, including how they identified, appraised, and summarized the current studies that provide information to answer a specific research question. For meta-analyses, they also performed a combined statistical analysis of the results of all the studies they selected. Notice how meta-analyses and systematic reviews are completely different from reviews. Reviews are not study designs at all. They are the lowest level of evidence. They review existing literature on a topic and provide an overview. They can be great background sources. So while they reference a lot of existing literature on a topic, the literature they review is not selected using a methodology as it is in a systematic review or meta-analysis. So you cannot trust that it includes all of the relevant literature on a topic. It's up to the author's discretion to select the literature, and so the selection may be biased. However, again, they can be good background sources. These are generally published in peer-reviewed journals, so while they should just be used as background sources, they have usually been reviewed by other experts in the field before publication. We have already talked about randomized controlled trials. Diagnostic studies evaluate a test for diagnosing a disease. Cohort studies are non-experimental study design and follow a group of people, a cohort, and look at how events differ among people within the group. For example, a cohort study might examine a cohort that differs in respect to exposure of some suspected risk factors, such as smoking, and look at how the group differs in terms of certain patient important outcomes, such as lung cancer. This can be useful for trying to ascertain whether exposure, for example, smoking, is likely to cause specified events, for example, lung cancer. Prospective cohort studies, which track participants forward in time, are more reliable than retrospective cohort studies, which look at past data about participants. Case control studies look at how a past exposure or lack of exposure to an agent, and then the difference in patient important outcomes between the two groups. So this starts back in time with the exposure or lack of exposure, and then looking forward in time to the patient outcomes. This type of study design is most useful for trying to ascertain the cause or of rare events, such as rare cancers. Case control studies provide weaker evidence than cohort studies, but are more reliable than case series. Non-randomized trials are when the treatment was assigned by a method other than random allocation. And cross-sectional studies are a weak study design, grade D. They involve surveying a population about exposure or condition or both at one point in time. They can be used for assessing the prevalence of a condition in the population, but should never be used for assessing the causality of a treatment. Finally, case reports or case series are analysis of a series of people with a disease where there is no comparison. They are also a low level of evidence. Finally, you will also find professional articles. These are articles in professional magazines written by other professionals in your field that provide best practices, news, editorials, their own experience, and information about new products. So these are not studies or evidence. Professional magazines are also generally not peer-reviewed, but rather just have editors. So while you can help stay current, they can help you stay current. Do not use information from these sources to make decision about your patient care. Gray literature are non-published sources that might also be useful for you. These generally would be of interest to you if you're doing your own systematic review or meta-analysis and wanted to make sure that you included all of the relevant literature on our topic. They're generally not where you'll look to find evidence for your patient care. Some examples of gray literature might be clinical trials that were registered with clinicaltrials.gov, but that were not published. Another example might be dissertations. You might also find conference proceedings. These can be useful, but not all conference presentations get published in peer-reviewed journals, and so you'll want to remember that when reading over them. You might, if you're considering publishing your own work, do your research on the journals before you submit your work to them to make sure that they're quality. And here is a website with a checklist to help you do that. So now that we've learned about different types of sources available to help us answer our clinical questions, we'll learn how to find them in the next video.